If you've ever had a stubborn, itchy rash that just wouldn't go away, you know how frustrating it can be. It can leave you wondering if it's eczema or psoriasis. What's causing all this discomfort? And most importantly, how can you make it stop? These two skin conditions can be incredibly confusing because they share some similarities, but they are actually very different when it comes to their underlying causes, symptoms, and treatments. In this video, we will take a deep dive into everything you need to know about eczema and psoriasis. We'll cover what they are, why they happen, how they make you feel, and most importantly, how you can tell them apart and the treatments that can help you regain control over your skin. So, without further ado, let's start with eczema. So, what is eczema? Eczema, also known as atopic dermatitis, is a skin condition that makes your skin red, itchy, and inflamed. Sometimes your skin may also become cracked or reepy. When you have eczema, your skin's outer protective barrier doesn't work as well as it should. This means moisture escapes more easily and irritants can penetrate more readily, leading to inflammation and that characteristic itchy sensation that drives many people crazy. Eczema tends to show up in places like the face, neck, hands, and in the creases of your elbows and knees. It's a pretty common condition, affecting up to 20% of children and around 10% of adults. Eczema often starts in childhood, but it can continue or even start for the first time in adulthood. The condition is characterized by flare-ups, where the symptoms become worse, and periods of remission, where the symptoms improve or even disappear for a while. Causes of eczema. The exact cause of eczema isn't entirely understood, but it's believed to be a combination of genetic and environmental factors. Your genes play a significant role. If one or both parents have eczema, hay fever, or asthma, you're more likely to develop it. Scientists have identified specific gene variations that affect your skin's ability to provide protection. Your skin's barrier also plays a role. People with eczema tend to have a weaker skin barrier, meaning their skin loses moisture easily and becomes more vulnerable to irritants and allergens. Environmental triggers can also contribute to eczema flare-ups. Common triggers include harsh soaps, fragrances, certain fabrics like wool, allergens such as dust mites and pollen, and even emotional stress. This is because people with eczema have an overactive immune system that responds aggressively to these triggers, causing inflammation. Cold, dry weather can also make eczema worse, as it dries out the skin, making it more prone to irritation. Symptoms of eczema. Eczema symptoms can vary, but they typically include red, inflamed patches of skin that are extremely itchy. The itch can be intense, leading to scratching, which only makes the symptoms worse and can even cause the skin to crack or bleed. You might also notice small, raised bumps that can leak fluid if scratched, and the skin can become scaly or thickened over time. The affected areas often feel dry, rough, and irritated. The itching can be especially bad at night, making it hard to sleep. In children, eczema often appears on the cheeks and scalp, while in adults, it's more common on the hands, neck, and the insides of the elbows and knees. Treatment for eczema. The key to treating eczema is keeping the skin moisturized and avoiding triggers that can lead to flare-ups. Here are some steps for treating eczema. Number 1. Moisturize frequently. Keeping your skin hydrated is crucial. Use a thick, fragrance-free moisturizer or an ointment like petroleum jelly at least twice a day. Apply it after bathing to lock in moisture. Number 2. Avoid harsh soaps and detergents. Use gentle, soap-free cleansers and avoid products with fragrances, which can irritate your skin. Look for cleansers labeled for sensitive skin. Number 3. Take short, warm baths. Long, hot showers can dry out your skin and make eczema worse. Instead, opt for short, lukewarm baths. Adding colloidal oatmeal or baking soda to the bath can help soothe the skin. Number 4. Topical steroids for flare-ups. Doctors often recommend topical corticosteroids to reduce inflammation and itching. These should only be used as directed by a healthcare provider, as overuse can thin the skin. Number 5. Antihistamines and prescription medications. Over-the-counter antihistamines can help control itching, especially at night. In more severe cases, your doctor may prescribe stronger medications, such as topical calcineurin inhibitors or even oral medications to suppress the immune response. Number 6. Identify and avoid triggers. Try to figure out what causes your flare-ups. It could be certain fabrics, soaps, or even stress. Keeping a journal can help you identify patterns and avoid triggers. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. So that's what you need to know about eczema. Now let's get to psoriasis and then how you can tell them apart easily. What is psoriasis? Psoriasis is an autoimmune condition where your immune system tells your skin cells to grow much faster than normal. So, what does that mean? Well, normally skin cells are produced and replaced every 28 to 30 days, but in people with psoriasis, new skin cells are created every 3 to 4 days. This is about 10 times faster than normal. This rapid turnover leads to a buildup of cells on the skin's surface, creating thick, scaly patches that can be red, itchy, and sometimes painful. Psoriasis affects around 2 to 3% of the population and can start at any age, although it often begins between the ages of 15 and 35. It tends to appear on areas like the scalp, elbows, knees, and lower back, but it can show up anywhere on the body. Psoriasis can also be linked to other health issues, like psoriatic arthritis, which causes joint pain and swelling. Causes of psoriasis. Psoriasis is an autoimmune condition, meaning that it occurs because your immune system mistakenly attacks healthy skin cells. This triggers inflammation and accelerated skin cells production. Genetics play a significant role. About 40% of people with psoriasis have a family history of the condition. Environmental factors can also trigger flare-ups, including stress, infections like strep throat, and certain medications like beta blockers. Another major trigger for psoriasis is skin injury. Something as simple as a cut, bug bite, or even a sunburn can lead to a new patch of psoriasis in what's known as the Koebner phenomenon. Lifestyle factors like smoking, alcohol consumption, and obesity can also make psoriasis worse. Symptoms of psoriasis. The symptoms of psoriasis are distinct and tend to be more severe than eczema. Psoriasis typically causes thick, red patches of skin covered with silvery scales. These patches, called plaques, are often itchy and can be painful. Unlike eczema, which tends to feel very itchy, psoriasis can be more painful, with a burning or stinging sensation. Psoriasis plaques can appear anywhere on the body, but they are most common on the elbows, knees, scalp, and lower back. The patches can be small, or they can merge to cover large areas of the skin. In addition to the plaques, some people with psoriasis may experience pitted, discolored nails, or even joint pain, which could indicate psoriatic arthritis. Treatment for psoriasis. Managing psoriasis often requires a combination of treatments to reduce inflammation, slow the production of skin cells, and manage symptoms. Here are some treatment options and tips for psoriasis. Number 1. Topical treatments. The first line of treatment for psoriasis usually involves topical creams and ointments. Corticosteroids are commonly used to reduce inflammation and itching. Other topical treatments include vitamin D analogs, which help slow skin cell growth, and coal tar products that help reduce scaling and inflammation. Number 2. Phototherapy. Light therapy or phototherapy can be effective for moderate to severe psoriasis. This treatment involves exposing the skin to controlled amounts of natural or artificial ultraviolet light. Phototherapy helps slow skin cell production and can be especially helpful for widespread plaques. Number 3. Medications. For severe psoriasis, doctors may prescribe oral or injectable medications that work throughout the body. These include biologics that target specific parts of the immune system to reduce inflammation. Methotrexate and cyclosporin are other options that suppress the immune system, but they can come with significant side effects and require careful monitoring. Number 4. Moisturize regularly. Keeping the skin moisturized can help reduce the dryness, itching, and scaling associated with psoriasis. Thick, ointment-based moisturizers tend to work best, and applying them after a bath or shower can help lock in moisture. How to differentiate between eczema and psoriasis. Although eczema and psoriasis can look similar for some people, there are key differences that can help you determine which one you're dealing with. Here are some important distinctions. Number 1. Appearance. Eczema usually presents as red, inflamed patches of skin that can be dry, cracked, or ooze. Psoriasis, on the other hand, tends to create thick, raised patches with a silvery white scale. Psoriasis patches are often more distinct and well defined, while eczema can appear more diffuse and less clearly bordered. Number 2. Location. Eczema often appears in body folds, like the creases of your elbows and knees on the face, neck, and hands. Psoriasis is more common on the scalp, outside elbows, knees, and lower back. Psoriasis can also affect the nails, leading to pitting or discoloration, which is less common in eczema. Number 3. Sensation. The itch associated with eczema can be intense, and scratching often leads to broken skin and bleeding. Psoriasis can also be itchy, but it's often described as more of a burning or stinging sensation. The plaques in psoriasis can also be painful, especially if they crack or become infected. Number 4. Triggers. Eczema flare-ups are often triggered by external irritants like soaps, fragrances, and allergens. Psoriasis, however, is more likely to be triggered by internal factors like stress, infections, and skin injuries. Number 5. Skin thickness. The skin affected by psoriasis tends to be thicker and more inflamed compared to eczema. The rapid turnover of skin cells in psoriasis leads to a buildup of dead skin, giving it that characteristic scaly appearance. So that's how you can tell them apart, however. If you're dealing with a persistent skin issue and aren't sure whether it's eczema or psoriasis, it's always best to consult with a doctor. They can help you get the right diagnosis and find a treatment plan that works best for you. Now, we want to hear from you. Have you struggled with eczema or psoriasis before? What treatments or remedies have worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.